Allie, and I'm going to be your nurse today. I've done a respiratory assessment, looked at your drain, and looked at your orders, and it looks like it's time to get a new drainage system. Could you please give me your name and date of birth?
Sarah McGree, 2/17/64.
Perfect. Okay, Sarah, so for this procedure, I'm going to turn your suction off, clamp your chest tube, get rid of this old system, and put a new system. Does that sound okay?
Sounds great.
Good. Are you having any pain right now?
No.
Okay, perfect. Just going to wash my hands, provide privacy, and raise your bed. So first I'm just going to assess your site and make sure that your dressing is occlusive. Are you having any pain while I'm palpating right here?
No.
Okay, great. So I'm just going to get your new drain set up. So I've got sterile water here, and I'm going to fill the water seal chamber to the fill line, which is 2 centimeters. And the order states suction at -20, so I'm going to fill the suction chamber with sterile water as well, up to 20. Okay, so I've got my padded Kelly clamps here, and I'm going to apply them about 2 inches away from your body. And each clamp is going to go in opposite directions, about 1 inch apart. Your suction is off, and I'm going to remove this tape. Suction ready here. So with this new system, I'm going to keep this end sterile. I'm going to remove the old tubing. And place this new end in. And I'm going to take this one long ways, along with this one on the other side. And then place tape around. Just like that. Okay, let me check the suctioning really quick. And the suctioning is still on. Before I apply this suction, I'm going to remove your clamps. Okay, Sarah, does everything feel all right to you?
Feels great.
Okay, so I'm just going to assess this new system now. So I want to make sure that the system is below the patient's chest tube so it can drain, and make sure that there's no loops or kinks in it. And then I'm going to see titling in the suction chamber if there wasn't any suction applied, which is a normal finding. And then I should, since there is suction, I'll see bubbling. In the water-sealed chamber, I don't want to see bubbling. That means that there's a leak. So if there is bubbling in the water-sealed chamber, I'm going to start at my patient's dressing and move outwards to see if I can find the leak. I'm going to assess the drainage in the old system with color and consistency, and then assess any new drainage in this system. At the end of my shift, I'm going to mark my initials and date where the drainage level is at on this system. After this procedure, I'm going to document the time, the patient's response, and the actual procedure itself, along with my findings of the drainage systems. Sarah, do you need anything from me right now?
No, I don't think so.
Okay, perfect. I'm just going to remove my gloves. Here's your call light. I'm going to place the bed down back to the lowest position. I would clean up all of my supplies before leaving the room. I'm just going to wash my hands. And Sarah, I'll be back in about an hour or so to check and see how you're doing.